Good afternoon, everybody, and welcome to the Samantha Kelly Show, our lunchtime LinkedIn Live. If you're having your lunch, thanks for joining us. And if you want to comment or ask a question, please do in the comments section. I'm delighted today to have with me Ger Conalty, who is the Head of Health Insurance Advisory Services at SYS Financial. Welcome, Ger.
Thanks, Samantha. Thanks for having me on today.
Well, I had to get you on because I saw you recently did some articles in Business Plus. So we'll go into that in a minute. I think it's a really important topic that I haven't really spoken about before as well. So anyone that's in the comments that wants to ask a question, please definitely ask the question. I'll see the question coming in. But Ger, first of all, tell us a little bit about yourself.
Yeah, so I've been working exclusively in health insurance now for 10 years, living in Dublin, in the position with a young family. So kind of health insurance, ironically, is something that's always on the forefront of my mind. So with doing this for 10 years, I feel like it's enough experience in this industry to be able to kind of highlight on a more emotional and human level the pros and cons of health insurance. And I think within the nature of the financial industry, health insurance is one of these topics that is a little bit kind of in a grey area and nobody knows enough about it. So I suppose my focus really is to kind of bring that expertise and experience to the front of what we do.
Yeah, and I know for me, I only probably recently got health insurance. I think it was 2 years ago, 3 years ago, because my husband got very sick. He was in hospital for 5 weeks, and I never had health insurance until then. And now I have it, and I know that you've helped me. And it was a real eye opener when I had a chat with you about the differences and all of the things. But I know as regards businesses and business owners and people who might be watching that are managers or HR teams, they would probably organize health insurance schemes for employees. And I know in the Business Plus magazine, you mentioned you actually cautioned employers and you advised them to question their health insurance plans ahead of renewal. So can you tell us a little bit about that?
Yeah, I suppose what we wanted to do was shine a light on really what's happening. Health insurance is an ever-changing beast in terms of what's happening year on year. We have multiple price increases, benefits get changed all the time, but also insurers are constantly bringing out new alternative options. So when we talk to employers, what we want to try and do is get them to shine a light on what they currently have and what's available in the market. Because when we look at price increases, if you are a company of, anywhere, if you're paying for health insurance for any number of staff, those price increases compound and can be financially, damaging to the company and budgets. But also, we want to make sure that employers understand that by just auto-renewing and kind of switching off and not paying attention to it, because it is an awkward conversation to have about benefits and trying to get your head around what's actually happening on the ground with your scheme. Auto-renewing is actually more damaging. So having a proactive conversation, explaining what you want to do and what you want to achieve, you can actually really unlock some great potential, but also make sure that you're not losing anything in the background that you might have lost out if you didn't take a proactive review on it.
Okay, so you do that for people. You would do a review of the health insurance plans they have, make sure they're on the right one. Do you do it for individuals or is it just for companies?
Our main focus is companies. It's an area of the industry that's kind of been overlooked a little bit, and employees are paying attention to health insurance along with all other benefits, alongside their pensions and group risk benefits. Health insurance is becoming, an ever occurring topic on benefits within companies. So employees want to know more. So where we want to try and see is that people are trying to save where they can from a personal perspective and then looking into their employers. But as an employer, you want to do what's best for your employees, but sometimes you need to make sure that it's financially suitable for the company. So what we try to do is guide people either from an individual who are starting out, maybe themselves as a director or a limited company trying to start something for a small number of staff. But then it escalates. The advice is the same for multinationals who are trying to achieve, a really robust benefits package for their employees, and health insurance is at the forefront of that for a lot of companies. So it's trying to guide them. But individuals, the advice is very much the same. It's pay attention and have that review, and assess constantly what's important to you personally, not just what the insurers set telling you should be looking at.
And I think I know for me, right, it's like, oh, sure, it's grand. I just pay the monthly thing or whatever. But I mean, I never even really looked into what I was actually paying for. But that's my fault, right? But I know that premiums are rising fast. So what are the three biggest mistakes employers make at renewal that end up costing them the most?
Well, the number one biggest is not giving yourself enough time to review it, kind of leaving it to that last minute, because what happens there is that it's a harder decision to make, from a company perspective, and you can miss the opportunity. Also, not actually having a proactive approach in terms of reviewing your health insurance scheme, independently with all the insurers. So some people, what they will do is as a HR manager or a director or whatever position is tasked with managing this, with the scheme, what they tend to do is, they look at it and go, well, what can I do? And they hear all the usual terms of, health insurance inflation, cost of claims, but there's also a multitude of factors. By having a proper review, you can actually look at an alternative insurer who's offering the same benefits, but at a lower premium. So they might have brought out a newer option throughout the year. You might be in just a time where they haven't increased their prices yet compared to your current insurer. So you can actually make, a conscious effort to maintain benefits, but also financially, save a huge amount of money for the company. And it's not just about the company saving; it's also about the employees. If there's higher premiums, it's higher BIK costs for employees, and any additional family members and employees might be paying for attached to the scheme. So having that review actually not only damages the company, but it also damages the employees' kind of bottom line in terms of their own financial stability. So we want people to generally focus on is giving yourself enough time, having a proactive review. And the other one as well is being very clear about what you want to achieve as a company and where you feel that there are certain pain points you want to address. By kind of just assuming that, somebody's going to look into this for you, you need to be very open about what you want to achieve. Because once you do that, a good third-party advisor, will unlock those, potential benefits that you're missing out on. And it's the little key details that they'll pay attention to that can make the world a difference.
And can I just throw a spanner in the works? I know we didn't have this on the script, but just to ask you, so let's say that HR, if it's the HR person that's doing it, and they say, oh, look, we're with these people for the past 5 years, or we're locked into, so would they be locked into contracts for 5 years? Like, what is it? Do you think they might think it's a bit of hassle,
Yeah, it is a daunting topic, and I've dealt with HR departments and companies before, and they do find it is a bit of a hassle because it's a year-long contract, and every year they have to assess it, and it can be a bit of a with other projects going on within the company, it can be a lot of time, a time-consuming exercise for them to do. So they kind of tend to neglect it a little bit. So I suppose what we want to try and do is get people to kind of pay attention a little bit more to what they're looking at. But also, even though you might say have missed the opportunity at your renewal, it sometimes can plan forward and look at what you could possibly do in the next 12 months. Maybe there's something that you can negotiate with your current insurer that you can maybe restructure slightly, explain the needs and objectives. Or you might have missed an opportunity, but we might be able to plan for the next year. So when that renewal period comes around, you already know exactly where you're going, what's happening, and what you want to achieve. So it's never, I suppose, a wrong time to look at it, but it's just a case of putting some time aside to have a proper review.
So for HR teams with renewal, let's say in the next 6 to 12 months, what does a focused review look like in real terms? What should they benchmark? What data do they need? And what outcomes should they aim for?
So within the next 6 to 12 months, what we know is going to happen is premiums are going to increase. So what we want companies, I suppose, to kind of, when we look at these reviews, is one is what's your budget looking like? Is there scope for you can't take any premium increases? So we can kind of factor that into the review. What we want to just look at is who you're currently with, what your current employee headcount is, and has there been any feedback or kickback from employees that you want to address? Is there something that employees keep mentioning that maybe there's a benefit that they keep asking about that they don't know or about or need to find out more? Is there scope for change? Do you want to enhance your benefits for your employees? Do you want to reward them? Is there, do you want to start covering family members? So what you want to achieve in the next renewal period. But the fundamental part is just where you currently sit, because what we look at is what the current scheme set up. Is there anything that should be there that isn't, and where we can make the change? Once we know that benchmark of where you currently sit, we can then have the conversation and help you kind of go through the next steps of, maybe it could be a slight increase in premium, but you might unlock a huge amount of benefits for the employees, or you could be on an option that you haven't reviewed for a good number of years. So there's a newer additional option that within your current insurer that might be more suitable for the employees on in a number of areas. But also just understanding how you can maybe change the communication with your employees. I like to ask the question have you had good conversations with the insurer and the employees at the moment? Do you feel that there needs to be more communication around what the benefits are and how we do that? So, how we can help you communicate to the employees the benefit of the health insurance package, not just here's your benefit, off you go. It's understanding it and making sure the employees are getting the most out of it.
So for people watching today then on their lunch or joining and watching the replay, hi, if you are watching, please, what can they do next? If they did want to have a chat with you, what's the story? What should they do?
Definitely reach out and schedule a call. We can sit down. What we like to do is initial just review, just to kind of just see what you want to do. Have a conversation, and let's figure out where your head's at and where you feel the pain points are. Identify those, and let's see what the next steps are. We can also kind of share some market insights as well, kind of where the price increases are going. Like the government levy is increasing again this year. It's going to be up at €517. So that's something that's going to affect premiums massively, for health insurance premiums across the market, corporate and for individuals. So what we want to do is kind of give you a little bit of insight of what's happening and shine a better light on health insurance and what you can and cannot do. So scheduling that call, let's have an introductory call and just see where we sit. There's no obligation, there's no pressure. It's just having an open conversation and then build it from there, and let's see what the best solution is for you as a company.
Thanks, Ger. Yeah, and I can tell you folks, Ger's lovely. He's great. He's very helpful. And I know he will definitely try to help out where he can as much as possible. So if anyone is interested, Ger's email is on the bottom, or message him on LinkedIn. And also, if you want to go to the website, sysfinancial.ie. Is there anything you want to add, Ger, before we wrap up?
I suppose the biggest one is just, I suppose, open your mind a little bit with regards to what you know about health insurance. We have a big thing we come across is there's a lot of I suppose a misconception with certain insurers and how the market works, and that's kind of been a hurdle for a lot of people, because they feel that they don't have anywhere to move. They might have had previous negative experience health wise. They might feel that there's a particular insurer that might be better dealt with it. The market is actually designed to be very well structured to protect the consumer, not the insurer. So let's be a little bit more open, because sometimes it's people have a already preconceived idea of what they want and how the market is. So when you break down those barriers and just open it up, it can be a real big eye opener on what each insurer is doing differently and what might be beneficial for you, especially if you have any kind of illnesses, or you're in a kind of in a position with a company that your workforce are you actively using the health insurance quite a lot. It's understanding that, and so where an other insurer that you may have not dealt with before might be more beneficial for your needs and objectives. So it's just that little bit more open mind. I like to compare it to similar to car insurance. When our car insurance renewal comes in, we don't hesitate to pick up and ring around, go online, do what we need to down. Health insurance is a little bit of the same. It's just understanding how it works. There's a lot of misinformation out on the market. Insurers will back me up on this, and other advisors, is that a lot of people kind of think they know how it works, and it's not down to naivety. It's just that the market is overly complicated. So, just kind of, it can sometimes be a learning curve as well. So that's the biggest thing we want to help people, is understand it better.
Excellent. Well, thank you so much, Ger. Have a great rest of your day. And if anyone does want to reach out, there's Ger's email on the bottom. And if you want to go even to the website, SYS Financial. Yeah, thanks a million for your time, Ger. We're all going to go and enjoy our lunch now, but I enjoyed that. Thank you so much for that
Thanks,
information.
Samantha. Thanks, everybody.
Thanks, everyone.